Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, caregivers, and seniors. With each Aging Insights program, we're interested in connecting people to their community-based programs and promoting optimal health. Senior hunger is a concern that we have at the New Jersey Foundation for Aging. Consequently, we often encourage seniors living on the edge of poverty to apply and utilize food and nutrition programs which enable them to access quality food. These programs include SNAP, also known as food stamps, or a senior lunch or nutrition site. By participating in these community nutrition programs, even Meals on Wheels, it implies that you're able to digest and utilize these foods. Today's topic is oral health and how it impacts our health. Our guests today are Rena Zelig, who has a doctorate in clinical nutrition, and dentist Sam Zwetchkenbaum, who is chairman of the New Jersey Coalition for Oral Health for the Aging. And you can correct me when you actually speak. Thank you today for joining us. You know, today's program was really prompted by a call I got from Sam. And it really was just sort of highlighted all of these issues. And when I was doing research, I realized that sometimes there are so many issues that we think are related to normal aging, whether it's muscle loss or bone loss. And some of these are really based in nutrition and the ability to utilize protein and fiber. So I'm really glad you're both here. And Rena, I wanted to start with you to talk about just the important nutrients that we really need for optimal health.
Sure.
Thank you for being here.
Thank you for having me.
Did I say your last name correctly?
You did.
Okay, just checking. So, could you give us some understanding about the importance of protein, for instance?
Sure. So protein is one of 3 macronutrients, the other 2 being fats and carbohydrates. Mm-hmm. Well, carbohydrates are really relied upon as kind of a fuel, mm-hmm. or the energy that our body needs to keep it going. Proteins play a somewhat different role. They have a role both in the structure and the function of our body. Functionally, we think of proteins as they relate, as you said, to muscle mass or strength. Structurally, they play an important role in the structure of our hair, our nails, our skin, and even our teeth.
Even our teeth. So what kind of level of protein do we really need?
So when it comes to protein, the magic number is 0.8 grams per kilogram. And in older adults, the needs are slightly higher, probably around the area of 1 gram per kilogram. To get your weight in kilograms, you divide your weight in pounds by 2.2. So for example, someone who weighed maybe 220 pounds, we would divide it by 2.2, so we'd get 100 kilograms. And 1 gram per kilogram, they would need about 100 grams of protein a day.
Okay, so if somebody is 150 pounds, doing that math,
yes.
Which is about 65 grams of protein. Not
yes,
kilograms.
That sounds about right.
Yeah, and so I think it's interesting to understand. So when you look at labels, you can actually figure out
how much protein you need. Exactly.
So, right. So I think that's very important. And do these factors in these utilizations of protein change as we age?
Yes. So unfortunately, as we age, our body composition seems to change a little bit. We end up with a little bit more fat mass and a little bit less lean body or muscle mass. And this occurs both as a result of the normal aging process, and as well, it can occur as a result of chronic diseases. Normal aging, there's a process called sarcopenia, which is a very fancy word, mm-hmm. that describes the normal age-related loss of protein. So starting on or about the 5th decade of life, we begin to lose approximately 6% of our protein stores or our muscle mass every decade. And the translation of that is by the time you're about 85, you've lost about 1/4 of your muscle mass. And our needs are going to routinely increase just to make up for these losses. In terms of chronic disease, there are certain chronic disease states that increase the body's demand for the utilization of protein. Mm-hmm. And this can include cancer or heart disease, especially heart failure.
Or healing.
Or healing. Yeah. So if you have surgery or you have a pressure ulcer, protein's really, really essential in the healing process. So your needs for protein will also be increased, even above and beyond the 1 gram per kilogram.
I never thought of it in terms of a pressure ulcer, which frequently you might see in mm-hmm. An institutionalized older adult. So,
yes.
So what are other effects impact our muscle loss?
So I think when we think of muscle loss, the first thing that comes to our minds is a decrease in our functional ability. So this is definitely caused in part by sarcopenia and our routine loss in muscle mass. It's also caused by osteoporosis, which is a routine loss in bone mass. And what happens is that over time, as we age, we end up with weaker bones and weaker muscles, which put us at an increased risk of falling. And not only an increased risk of falling, but an increased risk of obtaining an injury, such as a fracture, as a result of such a fall.
So which comes first? Sometimes it's the fracture.
Yeah, you know,
and then it's the fall.
It's a hard question of which comes first, but older adults are definitely at a higher risk of both falling and fractures as a result of these age-related processes. So when we think of osteoporosis, the nutrients that really come to my mind are calcium and vitamin D. And when I think of strength and muscle mass, I think of protein. So it's really important, not even just for older adults, but as part of the healthy aging process, even for young people, to get as much protein, calcium, and vitamin D as they need to make sure that by the time you get there, your bones and your muscles are a little bit healthier and stronger.
Right. I think it's important to realize those teenage years. It's important to recognize those reproductive years when someone is pregnant or lactating, and then to realize that we need to continue that forward so that we can all have optimal health.
Exactly.
I think sometimes we look at a variety of diets and they don't necessarily emphasize that balance. So I think it's good that we're talking about this. So what kind of, what would you suggest in terms of quality protein?
So proteins are generally divided into two different categories. Those that are of high biological value and those that are of lower biological value.
Biological meaning that you can access what's in the nutrient.
Exactly.
That you can digest it.
High biological value proteins are thought of as more complete proteins. And these really come from animal sources, your meat, your fish, your poultry, eggs, and even dairy products. Whereas low biological values proteins are incomplete. They don't have all the different types of proteins that we need. And these really come from your plant sources. So your grains, your legumes, fruits, vegetables.
And then there's maybe some protein in carbohydrates, but certainly it's not high value.
Yeah, I would consider it more like a plant source or a low biological value.
Exactly. The other thing that, when we were putting the program together, I realized that oral health really impacts your ability to utilize fiber. And fiber is really important too. So what are the key sources of fiber?
Well, fiber is one of my most favorite nutrients.
Oh, good. We found one.
Yes. There are a lot of them, but for me, fiber is really getting a lot of attention lately for its role in both health maintenance and the prevention of chronic disease, as well as the management of chronic disease. Fiber is probably best known for its role in GI or our gut health, that it helps keep food flowing more efficiently through our body, helps keep us more regular, and prevents constipation. But fiber has also been shown to be really important for heart health. It has a role in lowering our cholesterol levels, and as well it has a role in our glycemic control, or controlling our blood sugar levels, which is especially important for people with diabetes. Fiber also is a more complex carbohydrate, which means that it takes a lot longer to break it down. So it sits in our stomach longer, which means it keeps us full longer, and in such it has a really important role in weight maintenance. So it keeps you from eating too much and gaining too much weight. And good sources of fiber are your plant products, so kind of the opposite of the protein. These ones are higher in fiber, and that's your whole grains, especially if they're whole grains, legumes, fruits, and vegetables.
And fruits, apples, and other high-fiber, carrots, high-fiber.
The crunchier, the better. Crunchier it is, the more fiber it is, the harder it is to break it down.
And so now that we've sort of looked at the crunchier ones, I mean, so how does oral health really impact our utilization of both protein and fiber?
Well, the oral cavity really serves as the gateway for all nutrient intake. So if the integrity of the oral cavity is impaired, and that could be for any bunch of a number of reasons, ranging from really bad root caries or cavities to tooth loss to any type of oral infection, then our ability to adequately consume an adequate diet really is going to be impacted. So think for a minute about trying to eat an apple. We rely on our front teeth to bite into the apple, and then we rely on our back teeth to chew that apple up into small enough pieces that it's safe enough to swallow it. So if we have any problems with our oral cavity, it's going to be much harder to chew and swallow these foods, especially the ones that are higher in fiber.
Yeah, and I'm sure some of our viewers have had a toothache or a mouth sore or something that has really impacted their ability to enjoy a nice meal. So I'm sure that they're able to identify with some of the things that you've mentioned. And is this a real problem in terms of our older adult population?
So it is a huge problem everywhere. Data from the most recent World Health Survey has showed that about 30% of older adults over the age of 65 are completely edentulous, meaning that they have no teeth at all. And
30% across the country.
Across the world.
Across the world, I'm sorry.
Numbers in the U.S. are a little bit lower. I think the most current numbers in the U.S. are about 25% are completely edentulous with no teeth. But on average, older Americans in the U.S. have about 19 remaining teeth out of a maximum of 32. So that's just a little over half of our teeth are remaining.
Right. And so people also have dentures, right?
They do.
And how do dentures impact this? You would think a denture set would enable you to enjoy food.
So I think the data with dentures is really very mixed, and this depends on a lot of factors, such as the fit, the retention, and the stability of the denture themselves. And there's so many different types of dentures. There's definitely people who find that, with good dentures, their chewing quality is adequately restored and they can eat anything they want just as before. There are also people who have experienced a lot of pain and discomfort with dentures, or their dentures might not fit properly and they may be falling out and they become almost embarrassed to eat with their dentures in public. And for these people, getting adequate nutrition really is a big issue. And of course, regardless of be it with dentures or be it with tooth loss, we see that the foods that are most limited amongst these people are the hard-to-chew meats, which are your big source of dietary protein, as well as fruits and vegetables, which are your biggest source of dietary fiber and other nutrients.
Well, I really appreciate you sort of giving us a framework. And as I said, this really was prompted by a call from Sam about geriatric oral health. And I was like, well, yeah, this is important. And then we sort of talked about a lot of other things. But since we're sort of on the dentures and maybe even implants, although you didn't mention that, what signs, Sam, should a dentist look like so they know if someone is having oral health issues?
Well, I would say first thing, there are some signs, for example, looking at the tongue. If I see a tongue that's beefy red instead of pink, or a tongue that's very, very smooth instead of papillated. Sorry to use all these.
Papillated, so you could see their taste buds.
Taste buds. That might be a sign of nutritional deficiency, so some of the anemias. I've also noticed some dehydration in patients who aren't getting enough fluids. The tongue might look scalloped, so the tongue doesn't have the same turgor, and the teeth are actually pushing against the tongue.
Is it swollen, or is it that's just happening?
It's just happening by the teeth pushing against the tongue. The other thing is your immune system. And again, thanks for Rena for bringing up so many interesting things, but your immune system, if you have poor nutrition, is weakened, and we sometimes see redness at the corner of the mouth. We see a reduced response, a poor response to plaque. So a lot of the immune system is affected by your nutrition.
And does it affect your salivary flow? I mean, when you mention plaque, I think of that as maybe something you can, it would help if you had good flow.
Yeah, if you are dehydrated, you're not going to have enough saliva flow. But saliva does play a really important role in oral health. I would say, first of all, saliva moves the food around. So if somebody does not have enough saliva, then the food is going to pocket between their teeth, increasing their risk of dental caries or tooth decay and even gum disease. Saliva buffers the acids in the foods we eat. So if we're having sort of a lot of sugar in our diet and we don't have enough saliva.
No, you're eating all the protein and fiber.
Right.
But anyway.
Proteins and fibers are wonderful for your teeth. But if somebody has a poor nutrition and they're switching to a more, what we call a cariogenic diet, that's also going to be bad for their teeth. So that might be another sign. If somebody has poor nutrition, it can affect their teeth. So it's almost circular. But yes, saliva, I tell people it's like nature's magic potion for keeping your mouth healthy.
Sure, yeah. I mean, and what influences our ability to produce saliva?
First, let me say that reduction in saliva flow is not normal aging. So there's almost been a ageist assumption that as I get older, I have less saliva, that's normal. But studies have shown that healthy older adults have similar amounts of saliva in their mouth than younger adults. But older adults are more likely to take medications. So that's the main source of reduction of saliva flow. Some of the medications that have what we call anticholinergic properties, like antidepressants or medications for the bladder, can result in reduced saliva flow.
So are there also diseases that reduce saliva flow?
There are. Well, first of all, diabetics tend to have less saliva flow. And Sjogren's syndrome, which is a little rarer, but it's an autoimmune condition that we see in older adults. And any older adult or anybody who's had any sort of radiation therapy for cancer that may have affected their head and neck area, they would definitely have reduced saliva flow.
Wow. Well, you know, eating is such a social event, and I think that's what we want to talk about, promoting health and, you know, staying socially active. And Rena discussed how someone might feel embarrassed to eat in public. So what steps can we do, Sam, in your mind, to promote oral health?
Grace, it's a lot of basic efforts. The first is oral hygiene and you know, the good brushing and flossing. And one of the things is for older adults, it may get more difficult, either due to dexterity or cognitive changes, so they might need a little help, either from a special device. My dad uses these go-betweens, the little pointed things rather than floss. So there's some modifications we can make. Diet, getting back to the diet, obviously has significant impact. And also fluoride. Fluoride can remineralize our teeth. And some older adults...
At any age?
Yes, yes. And there are different ways we get our fluoride. Obviously from our drinking water, but we may need more, either from a fluoride rinse or a prescription fluoride. So for example, my mother is on an antihypertensive. And I love my mother, but I don't want to do too much dental work on her. She's not a great patient. So when she told me her mouth was getting dry from her antihypertensive medication, I prescribed a high concentrated fluoride gel that she uses every night. And the data shows that that can reduce root caries or tooth decay along the root.
Well, that's interesting. I didn't know there was a fluoride gel that you could use at home. I know dentists sometimes do a floral treatment. What about, there are some treatments for dry mouth?
Yeah. Well, first of all, let me get back to that fluoride.
Sure.
That's a prescription fluoride.
Okay.
Okay. And you asked me about other things we can do. Regular dental visits. So older adults need to continue with regular dental visits, almost as a measure of surveillance and risk assessment. So my mother was fortunate. She had me to tell her she should go on this, but if an older adult is not going regularly to the dentist, they might not have good access to risk assessment and a prescription for this special topical fluoride.
I see. And there are a lot of reasons, I would imagine, why an older adult may see the dentist less frequently than, say, a middle-aged or one of our boomer viewers.
Yeah, I would say there's definitely barriers to access to care for older adults. And one of the big ones is, unfortunately, financial. We know that only about 22% of older adults actually have dental insurance. For the rest of them, it's self-pay. Interesting data out of Maryland that looked at use of dental services, and it's after retirement, it's really based on wealth. So over 80% of those who are wealthy after retirement, over age 65, have gone to the dentist in the last 2 years, whereas of those who are poor, less than 40% have had a dental visit in the last 2 years.
You know, it's funny, we do a lot of work on the elder index and the cost of living, and I'm always surprised when someone says to me, well, seniors have free medical care, they have Medicare. Well, first of all, there's a premium that comes out of someone's Social Security payment. But in reality, Medicare doesn't cover everything. And even in speaking with you, realizing that dentures are not covered by Medicare.
It's a common misconception that Medicare covers dental. It really does not.
Does not.
There have been some supplemental plans that have included some dental prevention, and those are wonderful, but they really haven't taken off.
Yes, and I did ask someone at the state when we were talking about this, about the potential for maybe seeing some changes in Medicare, and in terms of it actually picking up dental care, because you can see how it impacts your overall health if we're looking at Medicare as a prevention program. And the response was, well, a couple of senators over the years have suggested that, but it really hasn't gotten momentum. Yeah. So maybe we have some real education work to do,
definitely.
I would think. And so I think that's kind of leads us to some of the work you've been doing with your coalition.
Right. So we started the New Jersey Coalition for Oral Health for the Aging, actually patterned after a coalition in Michigan. And you know, we bring together some dentists, some dental hygienists, and then non-dental stakeholders who are really concerned about this huge access to care issue for older adults. And, you know, we've just been starting up for about a year, and we're focusing on, number one, getting some information. So maybe doing some screenings. There's screenings going on at the national level looking at oral health of older adults, both in senior centers and in long-term care. So,
well, let's just stop for a second. Is this a bigger issue in long-term care? Oh,
yeah, most certainly. First of all, the older adults tend to be more functionally dependent and tend to, data shows, have more dental disease. Things have also, one thing to get back to, it was interesting you brought up rates of edentulousness.
And again, that is not having any teeth.
Any teeth, right, thank you.
All right.
I worked at the Jewish Home for the Aged of Rhode Island about 25 years ago, right after I graduated from dental school. And I would say about 50% or more of the residents of that nursing home were edentulous. Now I go to nursing homes and the rate is much less.
Much less.
So that sounds wonderful. Yay, yay, fewer people are edentulous. But also that means we have a lot of people who have teeth, who have dry mouth that's causing increased risk of dental disease, who have significant dental needs. So we need to figure out a way to help those older adults in long-term care have access to care. And access to care is primarily financial, but it's also how are these older adults getting to the dentist? Are they relying on transportation that may not be there?
Right.
How are they communicating with the dental office? And many of them do have Medicaid, but with the Medicaid does cover dental care, but unfortunately the low rates of reimbursement tend to be a deterrent for dentists to accept Medicaid. So finding a dentist who, number one, will accept Medicaid, and then one who is willing to go into a nursing home to provide dental care may be difficult.
So it is difficult, and I think it's, you know, the idea of seeing someone in the community who may have lost their dental insurance when they retired, you know, that's a barrier, and then to talk about someone who's really in a facility who has significant mobility issues, it really is an issue.
And people in the community need to continue with their dental services because preventive care, the regular cleanings, the prescriptions for the fluoride is so much cheaper than, you know, until we get to a point that dentistry is better covered and people are doing self-pay, they should know that it is so much cheaper to do preventive measures than to actually undergo more costly treatment.
Right. I was going to say, and as you mentioned dentures, Rena, it seemed to me that if they're uncomfortable,
you're not going to wear them. You're not going to eat with them. And really interestingly, you just mentioned about those who are missing teeth or have poor quality teeth. And what I've seen in my practice for sure, and the data also really supports that it's those people who have some teeth that aren't necessarily in as great shape as we would like them to be. Those are the people who are at the higher risk for malnutrition and who have a harder time eating because they may have one tooth on this side and one tooth on this side, and they don't have any surfaces that come together to really chew the food.
Right. And I guess that's where an implant or something else would perhaps address the issue, but you don't want to get there. The idea is to do the prevention work. And I think as we see boomers age, hopefully we will see a higher dental care, and at the same time, I'm just trying to think of the word where you're keeping your teeth. So I'm not
maintenance of dentition. Yeah. Replacement of teeth is important, but again, getting back to, and we discussed this earlier, that just throwing, I don't want to use this term, throwing new dentures in, just providing a patient with new dentures may not necessarily help them with their diet, okay? Because they've developed some eating habits either in their earlier life or when they were missing teeth that is unfavorable for their health. So to immediately assume by a dentist that providing dentures is going to significantly help their diet, I need somebody like Rena. I need to send them to Rena.
Together.
We have to collaborate in many ways, but one way is perhaps to ask the patient questions after they get their new denture. How you doing with their diet? And if they're not changing much, a referral is necessary. So I think collaboration like that, in the same way, she's going to see a lot of older adults who are having difficulty, and she needs to educate them about the importance of seeing a dentist.
And the other staff that you both work with, I think a dental hygienist is, obviously has that more routine view, shall I say, because they're doing the care on someone's teeth if they're not seeing the dentist all the time.
They're very preventive oriented, and a lot of the dental hygienists really take the time to ask the patient about their diet.
And the same thing, I think, with people that are in facilities that are not necessarily always able to reach Rena about a client, but that they see something happening.
The nurses staff, the nursing assistants, even physicians. Anybody can be educated to look in the mouth and make proper referrals.
Exactly. I think that's very important. The other thing is, now that we have managed long-term care, I think we have case managers that are working with people that are still living in the community, and they're getting home care. They're getting people coming into their home, or they're going out to an assisted living facility or a senior center because they're mobile and active. And I think there are other folks that we can kind of encourage to join Sam's coalition. Yes.
And I enjoyed going to your, the New Jersey Foundation for Aging meeting, because I had the opportunity to talk with people who are sort of on the cutting edge, and some of the senior centers are now going to get some health care in there, ideally including dentistry. So that improves access to care also.
Do you have a website for your coalition?
We have a Facebook site.
Oh, Facebook, okay.
But I think if somebody, I did make a website, I got to work on it, but again, New Jersey Coalition for Oral Health for the Aging. Would
be on your Facebook page. Well, I think this is a wonderful conversation. We probably got a little bit in the weeds, but I think it's really helpful to people to understand how important oral health is to the rest of your health. So I think it was a great conversation.
Thank you, Grace.
Thank you. I'd like to thank you again. I think it's just wonderful, and we could probably do, another hour or so, but anyway, maybe in the future.
We're happy to come back.
Thank you. Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor, you can contact us, or you can go to our website, which is www.njfoundationforaging.org. All of our previous shows are on our website too, so you can certainly watch other shows. We're very happy. We've covered a lot of topics over the years. We want to remind you to find out about senior services in your area. Please contact your county office on aging. Their numbers are on our website, or you may call the state hotline number, which is 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.